A mask or face covering, when worn properly, can act as a barrier to help prevent the spread of the COVID-19 virus. How do you safely put on and remove a single-use mask or face covering? To put it on, clean your hands with soap and water or hand sanitizer before touching the mask. If you're using a disposable mask, make sure it's new and hasn't been worn before. Inspect it for tears or holes. Do not use a mask that is damaged. Place the mask over your face, ensuring it covers the nose, mouth, and chin. If the mask has a nose wire, adjust it to fit snugly over the bridge of your nose. Make sure that your vision is not obstructed by the mask. Once your mask is on, avoid touching it again until it is removed. If your mask becomes wet or dirty, it should be changed for a new mask. Do not reuse a disposable mask that is intended for a single use. To remove it, clean your hands before taking off the mask. Before removing your mask, you should always assume that the outside of it is contaminated and handle it in a way that reduces risk to you. Avoid touching the front of the mask. Only touch the ear loops or ties to remove it. Hold both loops, unhook them, and lift the mask away from your face. If the mask has ties, untie the lower bow first, followed by the upper bow. Throw the used mask directly into a lined garbage container with a lid. Never leave it in a shopping cart or on the ground. And finally, after removing your mask, always make sure to clean your hands.